Good morning. I'm Eva Pilgrim in for Diane Macedo. Thanks for streaming with us. In today's update, President Biden is publicly calling for an end to the deadly violence in the Middle East as calls for a ceasefire between Israel and Hamas grow. Overnight, Israel released video of an aerial assault saying it was targeting Hamas tunnels in the Gaza Strip. Now, there is an unprecedented call for roughly 7 million Palestinians in Gaza, the West Bank, and within Israel itself to join a general strike. Those strikers are protesting the violence, which is now in its second week. 2 Israelis died from rocket fire, but no Palestinians were killed overnight. And Israeli Prime Minister Benjamin Netanyahu says the offensive will continue for now. President Biden is traveling to Michigan today, where he will visit the factory where Ford will produce the first electric version of one of its pickup trucks. It's all part of the president's push to make the case for his $4 trillion economic agenda. Biden's remarks this afternoon are expected to promote the idea that transitioning to electric vehicles can create high-paying union jobs. We will bring you the president's remarks live when they happen. And there are encouraging signs that the nation is turning a corner in this pandemic. Cases are down in all 50 states for the first time since the pandemic started. New York is one of the many states that are dropping their mask mandates for vaccinated people following the CDC's guidance change. But Americans are scrambling to keep up with these updated rules. Joining us now for more on this is ABC News medical contributor and infectious disease specialist at South Shore Health, Dr. Todd Ellerin. So good to see you.
Good to see you.
So I want to start with this new guidance because it's causing a lot of confusion for people. What are your thoughts on how Americans should navigate where and when they should wear a mask?
Right. Eva, you know, Saturday Night Live just did a parody on this, and it really is confusing. Why is it confusing? Because, first of all, you have CDC guidance, but then you have state guidance, local businesses, and then as individuals, how do we feel? And they're not necessarily all the same. I think some of the key points that I want to make is, number one, keep a mask in your pocket if it's not on your face. I think that's very important because at some point you may feel comfortable, but maybe you'll get into an elevator with someone who's unmasked, and maybe you'll get uncomfortable and you want to put your mask on. You should be able to do that. The second thing, no mask shaming. That just can't be allowed. We have to allow people. Remember, as you know, your wardrobe is very important to you. You've been living with a mask, as have I, for the past 14 months or so. So it's become part of our life. Just because we are maybe vaccinated, we still may want that extra layer of safety, and that has to be allowed. The third thing I want to say is really the unvaccinated people who go indoors. I think especially in crowded areas, that's the biggest risk to them if they take their mask off and they're unvaccinated indoors. So I really do agree that at this point, you know, if you're unvaccinated and you're indoors, especially in a crowded area, you want to keep that mask on. The last point I want to make, Eva, is immunocompromised people with weakened immune systems. They really need to think twice before taking their mask off indoors. Why? And this is even if they're vaccinated, because they may not respond as well to the vaccine.
That's some good advice and a good reminder to all of us to have patience with each other as these rules are changing. I'm curious, has this guidance changed the way that you yourself are approaching wearing a mask?
Right. So good question. Remember, I spend, most of my day in a hospital. So the answer is no. I'm masked, throughout the day there. And then I live in Massachusetts, and the Massachusetts state mask guidance hasn't changed yet, but it is going to be changing towards the end of the month. So I do believe that I'll be wearing a mask because I'm fully vaccinated. I will be wearing a mask less often. But again, I'm going to be keeping that mask on. I'm going to be keeping that mask in my pocket.
Yeah, and it's a good thing to have it in your pocket. You just never know how you're going to feel, right? So I want to ask you about these breakthrough cases, because we're starting to see that. Vaccines are supposed to decrease transmission, but right now we're seeing an outbreak with the New York Yankees. At least 9 fully vaccinated members of the team, a mix of coaches, staff members, and 1 player have tested positive after receiving the J&J shot. Their infections are mild or asymptomatic, but it does raise the question, are these outbreaks still going to happen?
Yes, and the most important part of the story is that most of the Yankees were asymptomatic or mild infection. Remember what we talked about. Some of us have said before, even if we don't reach that herd immunity ultimately, even if we can't eradicate this virus, hopefully we can turn it into more of a flu or even a common cold, better yet. And that's very possible. I think that's what we're seeing. Eva, what I want to remind you is that in the phase 3 Johnson & Johnson clinical trial, the rate of asymptomatic infection, the reduction in the vaccine group was about 66% or so, which is very good, but it's not perfect. So people were still getting infected even in the vaccine group. That's true of all the vaccines. Are there differences over time in the real world? We'll have to see, but I think that's what we're seeing. But I think the most important thing is when you're vaccinated, you tend to have a lower amount of virus, so you're less likely to transmit.
Also, given this new CDC guidance, more states, as you mentioned, are dropping their mask mandates. So for parents, what should they do with their unvaccinated children? Should parents with unvaccinated kids be concerned that their children are more at risk? I've heard a lot of parents discussing this recently.
Right, and I think that gets back to our first question, which is I'm not going to tell parents how they should feel. As parents, we're going to feel differently depending on our level of risk tolerance, perhaps whether our child has a weakened immune system or other comorbidities. So I think, again, what's important is to make sure that when you send your child out, if they're old enough, that if they're not wearing a mask on their face, they should have a mask in their pocket. And then also know, sort of what the local guidance is around if they're in sports or, what the state rules are or the school rules. And this is all going to be changing and evolving over time. But I think as long as we get as many kids vaccinated as possible, remember, that's the real shield, that protective shield. So what I would say to parents is please try to get your kids vaccinated if they're age eligible, at least age 12 right now, and keep that mask in their pocket.
Vaccinating kids gives a lot of parents anxiety. Only 37% of the country is fully vaccinated. And I've spoken to a lot of people who say they just want to give it a little bit more time. They want to wait and see what this long-term safety data says before they, as adults, even get it. What do you say to those people who are still, at this point, feeling pretty hesitant?
The first thing I would say is it's okay to be vaccine hesitant. That makes sense to me. I get it. We're still early on. The vaccines have been out, in the real world for, well under a year. But so far they look very powerful, very safe. And what I would say to them is keep asking people in your life that you trust, like your child's pediatrician or your internist or family practitioner, perhaps your obstetrician or gynecologist. Keep asking. Don't give up on it. And, the other thing is that what I don't want to see is ultimately what the headlines are going to show is that the vaccinated groups are going to be less likely to get infected and in the hospitals. And the unvaccinated people who acquire COVID are going to be more likely to get hospitalized. Again, we're seeing cases going down right now. Things are going in a great direction. But I think we expect to see more virus again in the fall and in the winter. I just don't want to see the unvaccinated individuals just be kind of, lacking that protective shield that lands them in the hospital or loved ones that we could have protected but didn't. So I just want people, don't give up on this vaccine. Keep asking the questions.
Yeah, and if you are hesitant, you still have time. You can get the vaccine at some point down the road when you feel comfortable. Dr. Todd Ellerin, we always appreciate you. Thanks for joining us.
Take care, Eva.
And we've all lived through a year we will never forget, but the pandemic hasn't just changed our lives over the past 14 months. It will also have an impact on our future, from where we work to how we interact, even how students go to school. ABC News Live Prime anchor Lindsay Davis took a look at the future of medicine and what that looks like in the long run.
Nasal swabs, PCR, rapid testing. These are just some of the words that became part of our vocabulary during the pandemic. We masked up, we social distanced, we isolated. But it wasn't enough. COVID took a devastating toll across the country. In New York, we saw freezer trucks outside of hospitals as the death toll mounted.
This reality slaps you right in the face. 437 deaths yesterday.
The healthcare system overwhelmed, stretched thin, but in the end, intact. We mourned the grimmest of milestones, nearly 600,000 American lives lost to the disease. The pandemic forced us to adapt, and medicine was, of course, part of that change.
Hi there, this is Dr. Desai, dermatologist. How are you?
With in-person visits too risky at the height of the pandemic, many doctors' offices switched over to telemedicine. And perhaps most importantly, the shots. 3 life-saving FDA-authorized vaccines have allowed us to gain back some semblance of normalcy. Both Pfizer and Moderna using revolutionary technology to create protection. Household names we hear now just about every day. It's thanks to science and medicine that we're now starting to see the light at the end of the tunnel. But that had us thinking, what other medical leaps lie ahead? We took that question and others directly to Dr. Ezekiel Emanuel of the University of Pennsylvania.
So, Doctor, we are obviously living through a once-in-a-century pandemic. Should we expect that they're going to start coming fast and furious, or is the next pandemic likely 100 years away?
It's probably not 100 years away, and it's probably not fast and furious in that next year we're going to have another pandemic. But we should anticipate more pandemics.
Are we ready for the next pandemic?
Absolutely not. We need to learn lessons from this pandemic on spread. One of the things I've done is I've studied how 10 other countries responded for an update of my book, which country has the world's best healthcare. And one of the things, major conclusions that I draw is that countries with experience, countries that really took the lessons, actually had a better response because they weren't winging it.
You said that we're not prepared for the next pandemic. What does the government, what does the private sector need to do today? What's the priority that they need to do to get prepared?
Well, that is a long list, actually. But on the healthcare side, it's clear that the CDC did not do a great job. We didn't do a great job on the testing. We didn't do a great job on the masks.
When you look into the future, is COVID-19 something that we're going to ultimately eradicate, much like we have with polio, or is this something that will be something that we're dealing with like the seasonal flu?
I think it's going to turn out to be more like seasonal flu. When we, and the key number, I think, for the audience to look at is the number of deaths. When we get the mortality rate from COVID down to about 100 to 150 a day, in other words, somewhere between 36,000 and about 54,000 deaths a year, then it'll be in the flu range. People are going to go into their routine lives when we get that low. I do think one thing we have learned from this pandemic, and I hope it sticks, is that wearing masks in the winter when we're in close proximity to people actually can make a big difference in terms of spread.
A lot of people weren't really familiar with the mRNA technology, even though it was something that really kind of started in the 90s. When you talk about that kind of technology, give us a sense of what it could mean ultimately in the future as far as other vaccines or therapies with regard to cancer or HIV.
You are going to see companies and researchers proliferate vaccines for adults against a number of diseases using the mRNA platform. So I think what we can anticipate over the next few years and decade is a number of new vaccines against infectious diseases that adults experience based upon the mRNA platform. And I think that's going to be a really good thing. As you know, increasingly, certainly over your and my lifetime, we have seen a number of vaccines for adults, not for kids. And these vaccines, you know, they make a huge difference to people's lives.
I just want to follow up on that because you made a distinction between adults and children's vaccines. And, you know, certainly there are many parents who are going to be grappling with the idea in a few months, perhaps, of if they should give their young children as young as 5, 6, 7 years old this vaccine, knowing that there isn't as much history. What would you advise those parents?
We also don't really understand the long-term impact on children, even if they don't become as symptomatic or don't have a high risk of dying. There may be long-term consequences in terms of cognitive function or lung function that we haven't yet determined. But I would give my grandchildren this vaccine just because I think it's that lower risk, and the benefits of not experiencing coronavirus and not running the risk of something bad happening long-term is probably a benefit.
What are you most excited about when it comes to the mRNA technology?
How fast you can make vaccines. I mean, I think everyone is, startled. I think Tony Fauci used the phrase many times of a land speed record. And this really is amazing.
What are the lessons that we've learned from the pandemic, in particular when it comes to the difference between rural and urban healthcare?
We have to use more telemedicine and digital medicine to link up those rural sites with urban centers where there are a lot of specialists and experts that can attend to particular needs. And in urban areas, one of the things we've learned is we can deliver care to people who are staying at home really effectively. And so we don't have to bring them into hospitals or into physician offices. Telemedicine and remote monitoring work really well. I think we're going to have to rejigger our payment system so that doctors still use them and can get paid to deliver care that way.
But you think more people are going to start zooming in to see their doctor than trudging all the way to the office?
Yes. If I had suggested that 3 years ago, people would have said, are you kidding me? COVID forced it. And I think a lot of people prefer it. You know, you'd rather be in your house where you know everything, it's familiar to get your chemotherapy than to be in a large institutional setting that, you don't control the environment.
Thank you so much for joining us, Dr. Ezekiel Emanuel.
And that was our Lindsay Davis. Thank you for that report. And that does it for this ABC News Live update. I'm Eva Pilgrim, in for Diane Macedo. Thanks for joining us. And remember, ABC News Live is here for you all day with the latest news, context, and analysis. I'll see you back here at 3 p.m. Eastern with Terry Moran for The Breakdown.
Mount St. Helens. For 123 years, it was dormant, but today the volcano exploded with a powerful force that turned daylight to dark.
Mount St. Helens literally blew her top this morning and has been belching smoke and ash ever since. There are unconfirmed reports of lava flowing on the mountain. The volcano was over 9,700 feet high, but lost an estimated 700 feet today.
Hi everyone, George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel, and don't forget to download the ABC News app for breaking news alerts. Thanks for watching.